Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is, will Medicare A and B cover all my expenses? And the answer to that question is no. Other than preventive services, you will always have to participate financially in your Medicare benefits. Okay, so other than preventive, everything is not going to be free. Okay, so let me explain how this works. Number one, original Medicare is broken down into two parts, A and B. A is called hospitalization, which is pretty much everything inpatient related. So let me show you your financial liabilities, your responsibilities. We call these gaps in your coverage. If you're going to the hospital, it's going to cost you a deductible. This year, $1,408. Now, this deductible is not annual. It's called a benefit period. And when someone is admitted to the hospital, their benefit period begins. When they're discharged, from the day of discharge for the next 60 days, they're still within their benefit period, which means after they're discharged, if they have to be rehospitalized during that 60-day period of time, they go back to the hospital, they're under the same deductible, they're in the same benefit period. But if you're hospitalized, discharged, 60 days goes by, and you're not rehospitalized during that time, but you're rehospitalized after that, then you would owe another deductible and you would start another benefit period. So this deductible could easily be paid 2, 3, 4 times in a year, depending upon someone's health situation. All right? So we have to pay a deductible. That's one of our liabilities. That's a gap in our coverage. Now, that deductible does cover us for up to a 60-day stay in the hospital, which is probably 99% of every situation. So it doesn't matter, notice, whether you're in the hospital 1 day or 2 days or 10 days or 60 days. Anything between 1 to 60 days costs you all the same. You pay $1,408 only, and Medicare is going to pay the rest. Now, if you happen to be in the hospital continuously beyond 60 days, when we get into the 3rd, 4th, and 5th month, now we're responsible for daily copays. So month 3, you have a daily copay of $352. That means it would cost you $10,500 out of your pocket for month 3 in the hospital. Again, that's pretty rare, but when it happens, that's how they bill it. Month 4 and month 5, they double the copay. Now you're responsible for $21,000 for month 4 and another $21,000 for month 5. Again, doesn't happen often, but that's how they bill whenever it does occur. And then we go to skilled nursing facility. This is also covered under Part A of Medicare. Here's the rules. Medicare says the first 20 days in the skilled nursing facility, and by the way, this is after a stroke or maybe a hip replacement or something, Medicare says first 20 days, they will pay everything as long as you were in the hospital a minimum of 72 hours. So 72 hours in the hospital or longer, Medicare agrees to pay all the expenses for the first 20 days. If you're in longer than 20 days, on the 21st day on, for the next 80 additional days, you are now responsible for a daily copay to the skilled nursing facility. This year, that's $176. They tell us right now the average recipient in Medicare in the skilled nursing facility is in for between 30 to 35 days. So you will be responsible for anything after the 20 days at that daily copay. So these are your gaps. You're financially liable for these. Medicare pays, but you will pay these. That takes care of A. Let's go to Part B. Part B is called medical on your Medicare card, and this is pretty much everything that will be outpatient services. So you've gone to the doctor, or maybe you've had a CAT scan, or maybe you had cataract surgery, or you've done anything on an outpatient basis where you've seen a doctor, or a doctor actually has come to see you in a hospital. Medicare B is always going to pay the physicians. Here is your part. B starts off every year with a deductible called a calendar year deductible. So if you're starting Medicare in January, this is your full 12-month deductible. But if you're starting Medicare in July, this is your deductible for the remaining part of the year. They do not prorate that. It's very low, very small, but you meet that deductible, and then what happens in January 1, it's going to reset. And sometimes that number resets a little higher, sometimes it stays the same. All right, but we have to meet the deductible for any of the B services, and after we've done that, then Medicare is a very traditional 80-20 plan. Medicare is going to pay 80 and you pay 20. Now please, remember this, for Medicare to pay their 80%, you must be seeing Medicare providers, someone that takes Medicare, and whatever that provider is doing for you beyond the office visit, could be a lab or test or procedure or surgery. Any of those services beyond just an office visit must be covered by Medicare. So if I'm seeing a Medicare provider and that service is covered by Medicare, that's when Medicare pays 80%, and I am now responsible for 20%. Now your part is called co-insurance, so this is your gap. You pay the deductible, then you pay the 20%. And here's actually your biggest liability in original Medicare A and B today, and that is your 20% is totally unlimited. And it never stops. Sky's the limit. All right. Now, there's a way that we can stop that with insurance, but when people only have A and B only, this is actually where they really get hurt, because this is where all the doctors are paid, and the surgeons, and the anesthesiologists, and the radiologists, and all the doctors are paid through B. And unless you have insurance, you will pay 20% of the Medicare approved amount, and it never stops. And then lastly, there are some physicians that take Medicare patients, but they will not agree to take Medicare reimbursement rates as payment in full. They add to the bill. And when they add to the bill, that is called an excess charge. And when they add to it, it's an additional 15% that you are now responsible for. So these are your gaps or liabilities on the B of Medicare: our deductible, our 20% that never stops, and the possibility of excess charges. And so the majority of people who decide to stay in original A and B will look at these liabilities, these gaps, and they don't want to assume those themselves. And so what people will do is they'll take these liabilities and they will transfer that liability to an insurance company, and that insurance company issues a Medicare supplemental plan, also called a Medigap policy. And anytime that you ask an insurance company to take your liability, you're certainly going to have to pay them a premium to do that. And they issue that policy, and they'll take on these gaps for you, either partially or in full. All right. And so if you need assistance walking through these gaps and the details and how it is that you can transfer that liability away, our Medicare School guides would be delighted to help you do that, would show you exactly what your options are for supplemental plans.